Hello and welcome to our program Where God Weeps, a program where we talk about the situation of the suffering church around the world. Today we're going to be considering the country of Kenya, one of East Africa's economic powerhouses, with economic growth growing now at about 5%. And yet, at the same time, there is 40% unemployment and more than 10 million Kenyans suffer from hunger. To tell us more about the story of Catholics in Kenya, it is my great privilege to welcome His Excellency Bishop Joseph Mbatia, the Bishop of the Nyahururu Diocese in Kenya. Your Excellency, thank you for being with us here today in our program.
And I thank you for inviting me to the studio.
Your Excellency, I want to talk a little bit about this situation in Kenya. Kenya is one of Africa's economic powerhouses. It has growth, a good communication structure, and relative stability in terms of the political situation. So in many ways there's much to be celebrated in the sense of Kenya's position in Africa and the economic growth.
Maybe let me not say that there is much to be celebrated. I would say there is no much to be celebrated, but all the same, there is economic growth. The infrastructure are not very good, only the major roads. But within the interior, the roads are in a deteriorating state.
Terrible condition.
Yeah, terrible condition. It's very hard to move, even, especially during the rainy season. So even the pastoral work is a bit difficult at times.
I wanted to touch on this question because at the same time there is economic growth, there is the work of the government to build up the infrastructure and the communications.
Yeah.
Most of the Kenyans live on less than $1 a day.
Yeah.
And so my question to you is, on one sense there is growth and good things, and the other side there's still an enormous poverty. Why this disparity still?
The economic growth is not concurring with the population growth. You find that there are so many people, okay, they are educated, some are educated, but they don't have jobs. Because if we don't have the industries, we don't have whatever within the country, so jobs are not available. Okay, the economy, we may say that the economy is growing, but it depends on what is calculated to be the economic growth. Because, you know, the GDP is taken from those available industries.
Yes.
Those available industries. But they are very few. They are very few. They cannot accommodate the population. And those who are the young people, from the age of 22, those who are coming out of the universities, there are very many.
Yes.
The jobs cannot be available. That is the greatest problem we have in Kenya.
If I can just put a finger on this point, because if I understand correctly, for youths of the age of 18, which is the largest, is the average age in Kenya, is 18, unemployment among youth is about 40%. So you have a lot of young people who come out of the schools and then have no jobs in front of them, which is must cause some tensions within the society.
Certainly that is true, what you are saying. They might cause tension within the society. Because for some few years now, the young people have been grouping together. You have that group calling itself this, the other one calling itself this.
How would you group them?
Some are ethnical, and they group themselves. And they can do all sorts of bad things, you know.
So they're living out this frustration, if you will.
Yeah, they are living the frustrations. But at the same time, because of the education system, the young people would not like to work for themselves. They don't want to work for themselves. most of those young people who are grouping like this, and those people who are coming out of the rural areas and grouping in a small town and doing all this havoc among the people, beating people, there is security risk everywhere.
Challenge also in Kenya is there's no social security network. It's not as developed. So I suppose a lot of poverty relief and a lot of these kinds of questions would fall back on the church in terms of providing some kind of support systems to catch people who are not able to manage, don't have work and not able to survive. How much can the church do for these young people to try and keep them away from these groups and from this criminal activity?
The church has been trying its best by establishing polytechnics so that it may give skills to these young people.
Vocational schools.
That is vocational schools.
The church is involved in education. In fact, this is a priority for the church. But you face the similar challenges. Not enough financial resources. If I understand correctly, you have up to 90 students in one classroom simply because the facilities are not available. How does the church work in education and try and overcome these challenges?
Mostly not those schools of the church that have that kind of population. Mostly is the government schools. You know, what happened is when the present president took over the leadership in 2002, he decided to give education free for everybody in primary school. And so many were brought into school because they are not now going to pay. So there was an influx of students coming to school to study and all that. So that is how the population increased. Okay, in the church, because the church has the best schools, okay, you'll have maybe 2 classes amounting to 90 students in a class.
Is the government looking to the church to develop more in the field of education? Because you have, as you say, the best schools in Kenya. And is the government saying, okay, we would like that the church plays a greater role in education?
Presently, they are discouraging the church so much.
But why? Why would they
bringing in things which are not, they would not like religion to be taught in a manner that the church would like, you know. At times they would like to push out the religious education, of which, if the church is not going to teach religious education, at least they will see that then there is no need of them being in school.
The church has also been very involved in social work, not only in terms of education, but also in terms of health care, for example, and other social outreach. I want to address one particular topic, and that is the question of HIV/AIDS. Because AIDS, of course, unfortunately, like in many African countries, is on the rise also in Kenya. The bishops have recently taken a position on the question of HIV/AIDS, and I was wondering if you could tell us a little bit about, first of all, the statements of the bishops with regard to HIV/AIDS, and then secondly, what is the church trying to do in this growing problem of AIDS?
Okay, in Nyahururu Diocese, we have a home for the AIDS patients, and we also speak about it openly in the churches, that people should avoid sexual irresponsibility, that it is abstinence.
It's education for life.
Education for life, and especially amongst the youth, to take life seriously. And when one comes to the age of marriage, that is the time one should speak about sexuality and the rest. But holiness is what is important. And
are the young people open to receive the message?
Some, yes. Because like now, 2 or 3 years ago, I was in the university. And there are so many young people who are ready to listen. Okay, there are others who are not ready to listen.
Of course.
And they prefer going for condoms and whatever because they don't want to abstain. But there are others who are very much ready to listen
to the voice of the Church.
Yeah, to the voice of the Church.
Your Excellency, we're going to take a break, and we're going to watch now a short report on the work of the Franciscan sisters, particularly with AIDS victims in Kenya.
St. Francis worked with those who were outcast in his generation, which was mainly the people with leprosy. But now that there's a big cure for leprosy, we looked around to see what other kind of people are really outcast and no one taking care of them, or on the fringes of society and discriminated against. And of course, when the HIV/AIDS pandemic hit Africa, that was where we saw the most need, and so that's where we went into.
The Franciscan Missionary Sisters for Africa have been working in Kenya for more than 80 years. For the last 30 years, their primary mission is the fight against the plague of the 20th century, AIDS. The sisters organize medical help in self-established hospices as well as private homes. In the face of government ineptitude and a feeble social care system, the Franciscan Missionary Sisters, together with their lay co-workers, are often the only persons who take care of and visit AIDS victims. And the need continues to be enormous. Each day in Kenya, AIDS kills 700 people.
Last year we saw 2,300 patients, I think, we looked after. At the moment we've got 1,400 patients. You see, it's home-based. Most people are sick at home. We only put in the hospice those who cannot be looked after at home, either because there's nobody there or because they've been rejected. It may be that it's a mother with young children and there's nobody else, you know, and they can't manage. Not every day. We can't afford it. Okay, so we go to the natural medicine.
So we're going to the natural medicine now, where what they do is they prepare food for people so that if they cannot take ARVs, they can use this.
Sister Gilles, a registered medical practitioner, has, based on many years' research, observation and trials, drawn up a food and medicine program aimed at helping the human organism fight AIDS and strengthening the body's immune system. She uniquely applies locally available natural products. In many cases, natural healing methods are the only ones available, as antiretroviral treatments, ARVs, based on chemically synthesized drugs aimed to destroy HIV, are too expensive and in any case not always available.
It clears out a lot of the virus from the digestive system, which is where they tend to congregate. And people sleep better, eat better, they lose a lot of their symptoms. And for most of them, the CD4 count goes up. The CD4 count is the measure of immunity. So this is the cabbage. They have to cut them very small. And they put it in water, and it ferments. It is this over here, and it stands for 3 days, and then it ferments. It's a bit like eating sauerkraut. This is Brazil nuts. Brazil nuts are very high in selenium, and selenium is needed to boost the immune system. And then they have what we call pili pili dawa, which is like a chili sauce, which is garlic and chili and all sorts of things, and that stimulates the appetite, it helps them to sleep, and it also boosts the immune system. The cabbage mallet, which we call it, that destroys harmful bacteria and stimulates the growth of the good bacteria. We started the same time as we started the ARV clinic, because we knew there'd be some people who wouldn't be able to have ARVs, either because their liver was too bad, may have been a bit alcoholic or something like that. People have great hopes. There's ARVs now, and they could get this medicine and they'd be well again. And then they're told, no, they can't have it. It was very, very, very disappointing. We realized ARVs have a limited time span, and they're very toxic drugs, and people do tend to get quite sick with them sometimes. Our aim, as far as possible, is keep people at home, support them at home. The nurses visit the homes. There are 90 voluntary health workers who look after the people in the villages. And we provide them with the medicines, we provide them with this. They come to ARV clinic, they come to the natural medicine clinic. And we provide food for about 130 families every day. So for the ones who really haven't got food and can't manage.
Fighting AIDS and taking care of HIV victims is but one of many activities undertaken by the Franciscan Missionary Sisters. Since they cannot run separate homes for the elderly, homeless and disabled, the sisters invite all the needy to their own convent situated in the centre of the Nairobi slums. Several times during the week, they open their gates to those in need. They provide food, medicine, clothing, as well as a comforting embrace. Just as it is with the victims of AIDS, the sisters give hope to the poorest.
The Cheshire Home. It's also a daycare centre for the aged and also a place for beggars of Nairobi to come and get washed, have a meal. Many of the people who are working here are volunteers, but a lot of them are young people who are looking for school fees. Most of them should have relatives who could take care of them, and that's the African tradition, that you take care of your elderly. They love that. Their children are their social security. So where are the social security for these ones? Where are their family? And the answer most likely is that a lot of them are sick and dying of AIDS or have already died. Old people who come in, drop in at the daycare center are with a child. Well, it isn't their child. It's probably their daughter or son's child, the daughter or son having died, and now the old person is looking after them. So there's really no sector of society that is immune from AIDS. It penetrates everyone, and it has destroyed everybody's life in many ways, because these old people shouldn't have the responsibility of looking after a little child.
Taking care of AIDS patients and the poor, unfortunately, does not eliminate the very cause of the AIDS epidemic. That is why the sisters offer comprehensive educational seminars to the young. Primary aim of these seminars is to prevent further infections, considering 1 in 20 children are infected every year in Kenya.
So you are very good children, I can see that, okay? We're going to go through something today, and the chart is on behind me. So we're going to look at that chart. What is it called? Behavior change process. The behavior change process. What does that mean? What does that mean? Behavior change means what?
The sisters, together with a team of qualified instructors, teach AIDS prevention in local schools. Their foundation is the established Education for Life Behavior Change Program. The program's aim is to guide children and adolescents to personal and spiritual development and teach them the best way of preventing HIV infection.
It must encapsulate the spiritual side, because people cannot change their sexual behaviour unless they are steeped in prayer and in scripture. And the impact seems to be that the children, when they leave the primary school and they meet my facilitators later in secondary schools, they say, thank you for helping us to be aware of the dangers of illicit sex.
When we started in Kenya, we were doing a lot of HIV/AIDS awareness, and that included just giving HIV/AIDS information. But we realized that HIV/AIDS information was not enough, because we had nurses and people who were quite informed dying of the infection. And so we learned very early on that we needed to enable people go through change in behavior, since this was the most essential strategy in overcoming the pandemic. And for us to do this, we came up with this process.
We don't stand up and tell them not to engage in sex as such. We let them tell their story. And this story can be, for example, the questions we give them is, why do boys engage in sex? Why do girls engage in sex? And then the other question is, how do girls use their free time, and how do boys use their free time? And when the answers come back, they are truly alarming. And they will say that they engage in sex to feel mature, to feel wanted, and to experience and to explore and to earn money. And then it's also a result of pornography.
The terrifying rate at which people are falling prey to the AIDS virus and the very high death rate amongst Africans was the impulse that lay behind an undertaking involving long-term preventative action amongst the young and adults called behaviour change. An Irish missionary sister, a doctor of medicine, was the main initiator. Working very closely with the government, Sister Miriam Duggan developed a programme in the 80s which, based on the HIV infection rate, has to date proved to be the most effective in all of Africa.
I was working as a medical doctor, obstetrician, gynecologist when AIDS came. The first reality was when we began to get many, many patients and many people sick, and we couldn't cope in the hospital with the numbers. I experienced so much pain and so many people sick and dying of AIDS. It really dawned on me that this disease is preventable. I had been involved in giving awareness programs and more statistics and information about how it spread, but nothing seemed to be changing.
Welcome back, ladies and gentlemen, to our program Where God Weeps. It's my great privilege to be speaking here again with Bishop Joseph Mbatia, the Bishop of the Nyahururu Diocese in Kenya. Your Excellency, you have a number of challenges ahead of you.
Yeah.
What would you say are the greatest needs in your diocese?
You know, as a person who is new now, I need to give priests sustenance. Not for every time that I would require their assistance, but if assistance can be available for us to have a project that will be assisting us in the future, that would be very fine. And the other project is how to cater for those who are less privileged within the social status of our diocese.
Your Excellency, thank you very much for having been with us today in our program.
Okay, thank you very much also. I appreciate it.
And thank you, ladies and gentlemen, for having been with us today on Where God Weeps. And if you'd like to know more about the situation of Catholics in Kenya, or perhaps if you would like to help His Excellency with his projects in his diocese, I would encourage you to look at the contact information at the end of this program, and we look forward to seeing you next week. Take care.